Namaskar everyone. I am Dr. Jain, practicing oncologist in Metro Hospital Faridabad. मैं आप सबका इस YouTube चैनल पे स्वागत करता हूँ। आज हम बात करेंगे ब्रेस्ट कैंसर के ऊपर। ब्रेस्ट कैंसर एक निरंतर बढ़ती हुई बीमारी है। इट्स लाइक एपिडेमिक इन द वर्ल्ड नाउ। आई शुड नॉट यूज वर्ड एपिडेमिक, बट येस इट इज स्प्रेडिंग लाइक एनीथिंग. So few facts which all of you should know about breast cancer is, number one, every 28th woman is suffering from breast cancer. Now इसका मतलब ये है कि हर 28 वुमेन में से जो 29th woman है, she is having breast cancer, and surprisingly every second woman suffering from breast cancer is dying of breast cancer. So situation थोड़ी सी grave है. With such advent, with such advancement of with the diagnostics, with the advancement of the science, still we are way behind the responses which we want to see. Why is it so? So before we go on to that, let us discuss what are the signs and symptoms of breast cancer. Breast cancer किसी भी महिला को या किसी भी फीमेल को कैसे पता लगेगा? What are the most common sign and symptoms जो हमें ब्रेस्ट कैंसर में देखने को मिलते हैं? Number one is lump in breast और armpit. हर ब्रेस्ट कैंसर में जो गांठ होती, हर ब्रेस्ट में जो गांठ होती है वो कैंसर नहीं होती, बट इट्स अ डिक्टम. एनी फीमेल हैविंग अ ब्रेस्ट लम्प आफ्टर 40 years of age should be checked for breast cancer. So it is said, it is taught to us that any breast lump is breast cancer after 40 years of age until proven otherwise. अगर किसी भी 40 साल की फीमेल को गांठ है ब्रेस्ट में या आर्मपिट में तो उसको चेक कराना अनिवार्य है. दैट इज वेरी वेरी इंपॉर्टेंट. नंबर टू, ब्लडी डिस्चार्ज फ्रॉम द निपल और एनी सॉर्ट ऑफ डिस्चार्ज फ्रॉम द निपल. ज़रूरी नहीं है कि ब्लडी डिस्चार्ज ब्रेस्ट कैंसर में ही आएगा, बट हाँ अगर ब्लडी डिस्चार्ज है वी शुड गेट इट चेक्ड. नंबर थ्री, चेंजेस इन द स्किन. प्यूडी ऑरेंज, आप लोग जब गूगल करेंगे यू विल सर्च फॉर अ टर्म प्यूडी ऑरेंज. प्यूडी ऑरेंज मीन जैसे संतरे का छिलका जब सूख जाता है वैसी स्किन हो जाना. ब्रेस्ट कैंसर के पेशेंट्स में जब स्किन इन्वॉल्व हो जाती है ब्रेस्ट के ऊपर का तो उसके टेक्सचर चेंज हो जाता है, विच लीड्स टू सिचुएशन नोन एज प्यूडी ऑरेंज, जिसमें हमें जैसे संतरे का छिलका होता है ऐसी सूखी हुई वो स्किन दिखती है, सिमिलर अपीयरेंस दिखता है हमें. फोर्थ इज ऑब्वियसली पेन इन ब्रेस्ट, ब्रेस्ट एनगॉजमेंट हो सकती है. नंबर फाइव इज इनमें से हो सकता है कुछ भी ना मिले. दैट इज वाई कम्स देयर इज अ रोल ऑफ स्क्रीनिंग हेयर. जब कुछ नहीं मिल रहा तब कैसे होगा? तभी वी डिफाइन अ रोल ऑफ ब्रेस्ट कैंसर स्क्रीनिंग. हेंस कम्स द रोल ऑफ मैमोग्राफी एंड अदर स्क्रीनिंग टूल्स विच आई एम श्योर यू ऑल विल गेट ऑनलाइन. So basically these were the signs and symptoms of breast cancer. So when we talk about the assessment, when we talk about the diagnosis, so it is known as triple assessment. हम diagnose कैसे करेंगे? ये तो patient female आई with a breast lump. How will we diagnose that female that she is having breast cancer or not? So there is something known as triple assessment. Triple assessment means first is the clinical examination, जो डॉक्टर पेशेंट के ऊपर अपने क्लिनिक में, अपनी OPD में, अपने हॉस्पिटल में करता है, by the physical examination. सेकेंड कम्स द रेडियोलॉजिकल एग्जामिनेशन. इसके अंदर आता है आपका CT स्कैन, MRI, मैमोग्राफी. एंड थर्ड कम्स दी पैथोलॉजिकल रिस्पॉन्स और पैथोलॉजिकल डायग्नोसिस, जिसके अंदर आता है FNAC या बायोप्सी. दीज आर द थ्री वेज विच इज नोन एज ट्रिपल असेसमेंट. जब ये तीनों हो जाते हैं देन वी लेबल अ पेशेंट एज सफरिंग फ्रॉम ब्रेस्ट कैंसर और नॉट. देयर आर वेरियस टाइप्स एंड सब टाइप्स टू इट विच आई एम नॉट गोइंग इनटू डिटेल ऑफ. Because basically I want to discuss an overview of breast cancer, especially the myths about breast cancer which is most prevalent in our society. If we talk about the treatment, so treatment is basically divided into four main headings. First is surgery, which can be again the breast conservation surgery, complete mastectomy with axillary clearance, or it could be a modified radical mastectomy. Types of surgeries obviously will lead to another set of discussion. Second is chemotherapy. Now chemotherapy has got the further bifurcation as chemotherapy, immunotherapy and targeted therapy. अब वो डिपेंड करता है कि जो हमारा पहले जो बायोप्सी पे या पोस्ट ऑप्शन में जो रिपोर्ट आई हुई है, जो हार्मोनल एनालिसिस के आया हुआ है. थर्ड वी कम ऑन टू द रेडियोथेरेपी. ना रेडियोथेरेपी आम भाषा में इसको आप लोग सिकाई कहते हो. दिस इज समथिंग नॉट कि इसमें गर्म हवा या बल्ब या समथिंग हॉट वाटर या हॉट वाटर बाथ या वैक्स लगाया जाता है. दीज आर द इनविजिबल radioactive rays which are given through a specialized technique which goes inside, get deposited at the tumor bed and then do the ionizing. With the help of ionizing radiation we treat the local area. And fourth is the hormonal therapy depending on the hormonal status. Now what is hormonal status? I am again saying this word. ये जब हम बायोप्सी करते हैं या जब हम सर्जरी करते हैं, सो वी गेट अ रिपोर्ट ऑफ ईस्ट्रोजन रिसेप्टर, प्रोजेस्टेरोन रिसेप्टर एंड HER2 न्यू रिसेप्टर. So estrogen receptor and progesterone receptor are the hormonal receptor which I am talking about. So breast cancer usually either is ER/PR positive or ER/PR negative, or they can be a multiple permutations of this, ER positive, PR negative. Depending on this, we decide patient whether she requires hormonal therapy or not. So this is in very brief that I have given you. I am sure everything is available online in the books where everyone can read this. Why I am sitting here to discuss and talk? Basically, I want to discuss all the myths about the breast cancer that is prevailing in the society. The first most relevant myth or misconception or hitch that a patient has is for the biopsy. एक सीधा सिंपल पेशेंट का स्टेटमेंट होता है कि सर बायोप्सी कराएंगे तो कैंसर फैल जाएगा. बट यू हैव टू अंडरस्टैंड, ऐसे कोई थ्योरी नहीं है, ऐसी कोई साइंस नहीं है, ऐसी कोई स्टडी नहीं है जो हमें ये बता दे कि इफ़ वी विल डू बायोप्सी द कैंसर विल स्प्रेड. नंबर 1. नंबर 2, विदाउट डूइंग बायोप्सी आई विल नॉट बी एबल टू डायग्नोज द पेशेंट एज सफरिंग फ्रॉम कैंसर. I can do n number of radiological tests, I can run a complete battery of tests, but until and unless I have a histopath, जिसका मतलब होता है कि हमने सेल्स को जब तक माइक्रोस्कोप के नीचे नहीं देख लिया कि यहाँ नॉर्मल सेल है या कैंसरस सेल्स है, वी वुड नॉट बी एबल टू गिव यू a diagnosis of cancer. So biopsy or FNAC as and when indicated is very very necessary for any sort of cancer, let it be breast cancer or any other cancer. Number 2, the myth is wearing a deodorant causes the breast cancer, कि deodorant या perfume लगाने से breast cancer होता है. So yes, there are studies which says that there are harmful chemicals in these deodorants or perfumes, but it causes cancer. It is still not proven. So it's a good news for all the females listening to me out there. You can all use your deodorants and perfumes. Still we have a next study which says this, it can cause breast cancer. Second most common myth is wearing a brassiere causes a breast cancer, especially the wired bras that are available today. So no, that and the theory behind it that it blocks the lymphatics of the breast, which causes collection of the fluid in the breast, which again leads to the formation of a breast cancer or change the normal anatomical cells. No, this is again a myth. ऐसा नहीं होता. So there is no problem in wear any sort of brassiere whichever a female prefers. Third is the injury or trauma to the breast causes breast cancer. Now this is very incidental. What happens actually is that there might be a lump जो कि undiagnosed आ रहा है, जो फीमेल ने नहीं देखा, चोट लगी, and when she palpated तो उसको lump मिल गया, तो इवेंचुअली हुआ कि चोट लगी तो लंप हो गया या ब्रेस्ट कैंसर हो गया. एक्चुअली इट इज अदर वे राउंड. तो इट इज अ ब्लेसिंग इन डिस्गाइज एट दैट टाइम कि लंप था जो हमने नहीं देखा था पहले, बट अब जब क्योंकि चोट लगी एंड वी पैल्पेटेड, हेंस वी गॉट टू नो यस द फीमेल इज सफरिंग फ्रॉम अ ब्रेस्ट लंप. लेट्स कॉल इट अ ब्रेस्ट लंप फॉर नाउ. सो सेल्फ ब्रेस्ट एग्जामिनेशन इज वेरी इंपॉर्टेंट by negating this myth that female self breast examination is very very important. So it's let's pledge on this Independence Day that every female will undergo self breast examination on her own for to take care of herself. Third is, if there is a family history, then I will definitely have a breast cancer. It is true that there is some percentage, when I say some percentage, almost 10 to 13% of the breast cancers are familial, are hereditary, but rest of the 87% or 85% are all sporadic. So it is not that कि a family history of breast cancer है तो उस female को breast cancer होगा ही होगा, and it is only related to the first degree relative, means mother, sister or daughter. इसके beyond there is no relevance of that family history also. So yes, if there is a family history of breast cancer, so I will advise that female to undergo regular screening programs, which I mentioned in the initial part of my talk. We have breast cancer screening programs, so that female should undergo that breast cancer screening programs, should take benefit of that rather than sitting back home looming around that she would suffer from breast cancer, if not today, maybe tomorrow. Fifth is every breast cancer has a lump. No, I told you many signs and symptoms in the beginning. लंप वॉज वन ऑफ देम, कि अगर लंप है तो ब्रेस्ट कैंसर ही है, ऐसा इट इज़ नॉट 100% ट्रू, और सारे लंप ब्रेस्ट कैंसर है ऐसा भी इट इज़ नॉट 100% ट्रू. Secondly, there can be a situation when there is no lump, like discharge from the nipple, like beauty orange, जैसे मैंने बताया था, skin changes हो गए, involvement of the double lymphatics, which are all signs and symptoms of breast cancer, which doesn't present as a lump also. So when you will read, there are various subtypes of breast cancer. There is ductal carcinoma, lobular carcinoma, inflammatory carcinoma. So all these have different presentations. All these are different behaviors. So the tumor biology cannot be predicted still. It's still a gray area in this modern science. We cannot be predicting how a tumor will behave tomorrow. So that is why it is never 100%. So we still have those gray zones to be worked upon. Moving on the myths. Men do not have breast cancer. This is again a myth. The chances of men having breast cancer is low. Agreed, but not that men cannot have a breast cancer. Yes, there are incidences. There are multiple studies which says in 2015 almost 2,400 men were diagnosed with breast cancer in US alone. Talking about Indian stats, so it was close to 4,000. So yes, men do have a lesser frequency of breast cancer, but yes, breast cancer can occur in men as well. Young women don't get breast cancer. This is again common, I will not call a myth, it's a belief that young females do not have breast cancer. But the thing is, the lump that is the most common presentation of breast cancer is little difficult to palpate in a young breast, in a young female's breast, because they are quite dense. So that way, the young females having a family history, as I said, or as I said, doing a self breast examination is all the way more important as compared to elderly female, because the breast is usually dense, so it is not the lump are usually not palpated well. So it's a myth, it's not a fact. Yes, yeah, we do have females as young as 20 years, as young as 18 years suffering from breast cancer. So moving on, if a woman is pregnant, she cannot get breast cancer. In fact, the woman who is pregnant, who is lactating in the postpartum period, the diagnosis of breast cancer becomes difficult, because again, for the same reason, the breast is enlarged, the breast is engorged, the palpation becomes difficult. So the lump goes, or the changes in the breast architecture goes undiagnosed, saying that this is because of the lactation or the postpartum period. So it is a myth that if a female has got delivered a child, or if she is pregnant, she will not have a breast cancer. It is not true otherwise. If I eat right, don't smoke, exercise well, don't have alcohol, then I will not suffer from breast cancer. This is, I am telling you, a real life incident in what happened in my OPD last month. I got a well-educated female coming from a elite class to the OPD, and she said, I am doing everything right in my life, then how come I have a breast lump which is ultimately diagnosed to be a breast cancer? So it's a myth. You can only protect yourself by doing all this, by exercising well, by not smoking, by not getting into any injurious health activities. But ultimately, there are sporadic cases which will happen and which are bound to happen. So the only way to not have cancer is not to be born. It's a very common saying in today's world. If you don't want to have a cancer, then you should not be born. So it is that rampantly spreading across the globe. So on this Independence Day, let's all pledge that we will be fighting against, we will join hands in fighting against cancer, and would have freedom from myths about the treatment and cancer. So it is very important to understand the gravity of the situation. We are very advanced with our technologies in diagnosis, in treatment, but yet every second female is dying of breast cancer. That is very, very worrisome. On this note, I like to thank you all for listening to me. I'm Dr. Sunny Jain. See you all. Stay fit, stay healthy. Thank you.